I'll just wait for the slides to come on. I will say, as that's getting set up, that I have the unique challenge of standing between you and lunch. So I will try to be brisk and entertaining. And for those of you that are watching by live stream, bon appetit. Thank you, Michelle, for the introduction, and Dana for the remarks. I really appreciate this great opportunity to have a conversation with you today about digital and social media and how it can be harnessed to benefit communications about health. I'll focus on what this means for organizations, but really also what it means for each of you as individuals. So as I'm talking, I do want you to think about what this means for the groups that you work with, but also for you personally. I want to thank the Robert Wood Johnson Foundation for many years of direct collaboration on a wide range of communications projects, and particularly for the freedom that they have given us to propose innovative solutions, in some cases solutions that at first blush might seem crazy. They have been willing to work with us, and we really appreciate and value that collaboration, and especially to Joe Marks at the Foundation for working with us every step of the way. My name is Carlos Roig. I am a former high school educator and a former journalist as well. And the work that I do in communication strategy really draws on those two areas. And while the three things that I've done may seem not entirely connected, the way that I look at them is everything is about smart analysis, research, solutions, and then finding a way to communicate that clearly. It's about education. So I'm going to talk today about digital and social media writ large. We can no longer say that digital and social engagement sit in the world of new or emerging media. It is simply media at this point. This is now the manner in which ideas are presented, tested, and distributed in the public square. And I really believe that this requires a fundamental recalibration of how we think of content creation, distribution, and engagement. This is about much more than social media. In short, the digital media upstarts are rapidly becoming the incumbents, and that has a great effect on the way that all of us do our work. An example, take the Washington Post. It sits in the nation's capital, and because of that location, and we've talked about this a little bit today, has access to the country's leaders, its policy debates, and all the intricacies of our biggest national and global issues. It has long been seen as the height of aggressive reporting. I love Carl Bernstein's cigarette in the picture. I know that it will rankle some folks to see that, but it does have a certain panache of the era. Watergate and the reporting that uncovered that scandal has entrenched this institution in our minds. But the institution is facing great challenges. If for no other reason, then it is a content company first and a technology company a distant second. The options for original reporting or aggregated copies of that work have proliferated. We are much more likely now to learn about breaking news on a social platform or through a push notification on our mobile devices than from proactively seeking out the website or print publication of a major news outlet such as the Post. But let's get another perspective on the media and communications landscape. Someone who can provide a dispassionate analysis of the direction we are headed with digital platforms, content streams, and engagement around that content. This guy. The reflection of every bullish investor on Wall Street. They've never been particularly shy, and while they may overbet on individual companies sometimes, they generally have a fairly good sense of where to place big bets by industry and sector. So let's go back to our good friends at the Washington Post. The Washington Post was recently acquired by Amazon.com for $250 million. Now, $250 million is a sweet sum. It sounds like a huge amount of money. But if we look at it contextually of where the value of the company was previously and where it stands now, but also relative to other companies, it starts to look like a small figure. BuzzFeed. BuzzFeed was started by Jonah Peretti. The editor-in-chief is Ben Smith, who was formerly at Politico. BuzzFeed is well known for listicles, which are list-based articles, cat videos, and all manner of interesting content. What is interesting is that they are increasingly expanding their news media, their reporting investigative journalism. It is a mix of content. BuzzFeed recently raised venture capital money at a valuation of $850 million. Instagram, photo sharing social platform, recently purchased by Facebook for $1 billion. Billion. Vice Media. Vice Media is also a news outlet with very aggressive digital and mobile distribution strategies, recently raised funds at a valuation of $2.5 billion. We are getting orders of magnitude away from where the Post is. And then finally, WhatsApp. This is a text messaging platform that was acquired by Facebook for $19 billion. So in terms of digital content, storytelling, and engagement, where does this leave us? Dollars are flooding the platforms that may pejoratively be called social media, but how long will it be before we all start to think of them as platforms that benefit our organizations, our communications efforts, or even ourselves as individuals? I am not here to say that every one of you in this room, or every one of you watching at your desk, needs to be on every social platform, that your organizations need to shelve other modes of communication in order to replace everything with tweets and posts, or that you need to ditch traditional earned media for a digital stream of kitty cat videos or lowbrow bickering. This is not how I see social media. This is not how I see digital media. But I do see these as incredibly, incredibly important platforms for how we move ourselves forward. What I am here to say is that there is an opportunity before you to better understand the various platforms, to find the ones that make the most sense for you as individuals and at various levels within your organizations, and then to exploit those platforms. And I use that word very purposefully. This is about exploiting platforms for content distribution, for engagement, and for the solutions of the problems that we learned about from the panel that was focused on journalism, about the health problems that affect us. These are significant things. So I do want to just quickly take a walk through. Dana mentioned some of these, but Instagram I talked about a little bit before, very much focused on photo sharing. Tumblr is a very popular multimedia blogging platform. The audience skews younger, as does Instagram. Reddit, kind of focused on community source news. They also have something called an AMA, an Ask Me Anything event. President Obama and others have used this, but it's another platform for news and engagement. Pinterest, visual bookmarking. It's really frequently used for DIY, do-it-yourself kind of stuff, recipes, fashion, but a lot of organizations are increasingly using it both for marketing purposes, but also for public interest and public safety communications campaigns. Facebook, obviously personal connections, but it has great value too. I think someone mentioned earlier the importance of using social media not just for pushing out the work you're doing, but also the engagement. Facebook provides those opportunities. Twitter, really about bite-sized content creation, short snippets. I think we lose focus on the value of Twitter if we're just thinking about the tweet itself. It really is about the content and where we're driving people subsequently as well. So it's about where you can send people. And then LinkedIn, which is a professional networking site. Of all of these, it is the one where people are reflected as close as possible to their true selves. It's in essence your resume put online. Increasingly, they're applying a lot of content focus as well. So in terms of point of view, what is my view or our view on digital and social media, and how do we start to apply these to health-focused communications campaigns? We see social media through the following lens and really see it as part of a larger digital strategy. So as you start thinking about the work that you do as individuals or even your organizations, social media is not a panacea. It will not solve all your ills. It will not make sure that the research report that you worked on or the PR campaign or whatever you're working on is going to get to everybody you want to know. But it is a key tool. It is part of a larger strategy. So if you think about who you are as individuals, how you're represented online, but also your organizations, it's incredibly important. We see it as a modern professional tool for content and influence. These are not platforms when used from a business perspective to simply tweet about what you had for breakfast. This is about real people doing real work and engaging in real ways that translate into real-life action. It is a modern professional tool. Just because you can do it doesn't mean you should. I firmly believe that there are instances where social media may not fit for you as an individual or for your organization. Assess it. But the only way you're going to assess it is to really understand it. To simply eschew it and say, well, we're not going to focus any attention because it doesn't make any sense, but not to have done the due diligence to understand it really isn't quite the right approach. Just because you can do it doesn't mean you should, but if you determine that you are going to do it, you need to commit to it for the right reasons. You need to think about what it realistically can do for you, what you want it to accomplish. Start smart. This applies to journalism, it applies to research, it applies to anything. Do your homework. Survey the landscape, understand it, do your homework ahead of time, make a plan, and engage in the right way. Do not simply rush headlong into it without thinking about where you're actually participating and what you're going to be doing. And then lastly, build influence surgically. Think about who you want to influence, who you want to engage with, who you want to read your content, and then systematically go after understanding the landscape and who you can reach. Increasingly, as I'm talking about these things and thinking about them, we really look at how platform content and engagement play together. And just a brief anecdote, I worked at USA Today prior to coming to Homefront Communications, and I was on the digital side of the ledger, so I was one of the digital folks. And the newspaper was very much structured as a newspaper. It created its content on a print publishing schedule. Its entire focus at the time, and this was only 8 years ago, 10 years ago, their entire focus was what they were creating for the newspaper, and then what they would do at the end of creating all that content that was perfectly formatted for a print product, they would then turn to the digital team and say, make it sing, make people read it. What we are doing and what we've really done with the foundation to a great extent is about thinking about these three things together: platform, content, and engagement. You build platforms, digital platforms, websites, or you use social media because of the potential that they give you for content distribution and for engagement. You create content because you know the platforms where your content is going to land, and you build your engagement plans based on the content that you have and the platforms that you've built. These things have to affect each other at the beginning. So if you are doing research and at the end you are handing it to a communications, marketing, public relations team and saying, make sure people find this, and you haven't talked to them prior, they won't be able to do anything with it. It has to happen early. The conversations have to be synchronized at the beginning. So when we think about content, think about it in terms of quality, volume, and impact on social channels. The pieces of content you create may be photography, advertising, video, whatever it may be, but you need good quality, you need volume, steady consistency, and you need to impact. So a couple case studies here to think about this. Obviously, you all operate in a very crowded media environment. You have many goals, from spreading the word about your research to ensuring that your findings are applied to benefit individual or population health. But you also need to contend with the fact that your target audiences have a million other things vying for their attention. This is an area where developing digital and social profiles have great advantages. So a couple quick case studies. We've worked really closely with the Robert Wood Johnson Foundation for the last 3 years on a site called NewPublichealth.org. When we originally started working on this, the foundation had rwjf.org was their centerpiece. What they were finding, what we were finding, were that most visitors to the site were primarily looking at two things on the website. They were looking at who works there and how do I get your money. So the primary pages that were being seen were leadership and staff and grant opportunities. We took that knowledge and basically said, it's not going to work if we try to create rwjf.org as a content portal that people are going to come and read content on a regular basis. At the time, what we did was we built a site called newpublichealth.org that was designed to communicate about public health news and information in a steady, journalistic way. We were given the freedom to set this up and run it. we were not required, and this is really a testament to the foundation, we were not required to weave a core message or a program area into every piece of content that we created. And we hired former journalists and folks that had worked within the Department of Health and Human Services who focused on communications digitally to create content and distribute it. We're 3 years deep in the project. Obviously, a lot has changed at the foundation in terms of how they talk about health, and we're really on a big cusp with them in terms of how they are changing, sort of more a focus on the culture of health as opposed to what was then discussed as a new public health. But the results are there, both quantitatively and qualitatively. And one of the things I wanted to highlight in here is that we have worked really closely with the foundation to cover conferences like this, to actually put reporters on the ground and to cover it both for newpublichealth.org and through social media. And that's been one of the big ways that we've been able to push this content and make sure that people find it. We've also worked with campaigns that are built on that foundation. So we took the work that Trust for America's Health and RWJF have done on an annual infectious disease report. What we'd found was that over the years, the news media was very interested in it. It was primarily focusing on assessing gaps in our public health system that could severely limit our ability to effectively respond to an outbreak. But what the news media was basically saying to us was, yeah, it's really interesting, but we're unprepared. And we knew that last year, and we knew that the year before. And one of the things that we worked on this year was finding a way to create something that had a little pop in the digital space. And so we created what we called Outbreak Week. We took a little cue from Discovery with Shark Week and that whole notion. But the idea here was to have an entire week that was focused on infectious disease, to focus on the content from the report, but also to make in graphic form the case that this really merits attention. We had a whole series of Petri dish graphics. We had animated GIFs with people sneezing and the spittle forming the words Outbreak Week. But it was attention grabbing. It got people's focus on it. The news media started to pick up on it. We pushed out this one tweet that said, "This video is more viral than kittens." And it was a 15-second video that had cats and motorcycle crashes and all the kinds of things that we consider viral. But it ended with this man sneezing and Outbreak Week and the hashtag and the announcement of what was coming. So again, when you get someone like Richard Besser to sit up and take notice, it's obviously something that we really wanted to accomplish. We've worked with TEDMed on a series of 40 Google Hangouts. These are basically live, moderated broadcast events that play out on a social platform. The whole idea there was to focus on participating organizations that are working on health challenges. So we brought in folks from HHS and Kaiser Permanente, Siemens, Cigna, and a whole bunch of other places. But the idea there was to convene conversations on social platforms. Again, really content that moves the conversation. Worked with Toyota and Cincinnati Children's on public safety campaigns that had web and social components. Have worked with the Carnegie Endowment for International Peace, focused on social media and its use by individual leaders within the organization. And this is really notable and important. The whole idea here was to focus on how you can build people and their individual brands in the digital and social space. Carnegie at the time, and I would be comfortable saying this in front of them, were laggards in the think tank competitive set in Washington in how they use digital and social media. They really weren't very active on it. They had almost no one within the organization individually that was writing about their research, yet they were a powerful force for writing about global issues. They're one of the rare think tanks that doesn't just sit in Washington. They have global offices out across the world. And so what we were able to do is work with individuals there to build their profiles. Penn does an annual index of think tanks in 2013. They were very proud of this fact, and we were very proud for having worked with them, that they were given this award for best use of social networks, that they were an organization that really had propelled themselves forward and had done great work. So just a couple quick trends, and again, I do apologize for standing between you and lunch. 4 things here. Non-media organizations are increasingly operating as digital publishers. The barrier is broken down. We no longer need to rely exclusively, though we certainly still do rely on news media, don't need to rely exclusively on news media to pick up and cover and write about the issues that we may find near and dear. News media organizations have done a fair job of covering health and healthcare, but a fairly abysmal job, in my perspective, of covering public health. Curation and creation, increasingly important that the content that gets created is both pulling the best from other sources and talking about it and adding value, as well as creating original content. Individuals as brands, more and more, each of you in this room need to think about how you are perceived in the digital space. It's imperative. You would not come to an event in person without preparation. The same applies to the digital space. And smarter evolving metrics. This is an area where no one has cracked the code on how to do the numbers in the right way. And especially for this audience, we know data is really important. Quantitative metrics about impact on digital social media are critical, as are qualitative. We need to be able to put the two together to capture a story. Just a few tactics, and then I will wrap up. A few tactics in terms of this, thinking about what organizations can do, establishing new voices and extending existing ones on digital and social platforms. Almost every organization at this point has some sort of a social media presence. I would argue that that's good and important. It has value. But each organization needs to think about who are the people within that organization that are notable enough and merit enough focus and attention that they can be built up as new voices in that digital space. In essence, to add to the chorus of conversation that's out there around the issues that matter to you. Merge online and offline initiatives. When you come to a conference, you probably look through the attendees and figure out who it is that you would like to talk to, who you would like to buttonhole at some point to tell them about your project or to get some perspective from them. You need to do the same thing on digital platforms. Think through how you're reaching out to those people ahead of time or how you might engage with them after the fact. Systematically grow audience. We know this in the fields of research. It applies in the fields of digital and social media too. Do your homework, figure out who you want to talk to, and reach them. I talked about this a little bit before with creation and curation, but you do want to provide a filtered read of the web. None of us have any time to read everything about everything. We rely on other individuals to filter the world for us. We rely on journalists who cover particular beats to help us understand what is most important in health, transportation, economy, whatever it may be. It is no different in the space that you work in. If you provide a filtered read of the web to your audience, they will continue to come back, even if every single time you send them someplace other than your own website. There is great value in sending people away from your website. Develop unique content for digital and social use. Certainly want to think about the platform you're operating on and what content is going there. Identify, pursue, and engage with users by category. If you carve up the world around you by category and systematically approach who you want to talk to, it makes it a lot easier than to say, gosh, I want to talk to everyone. And then participate in live social media events. Dana referenced this earlier. Certainly social media events that you might put together, but also ones that others might have. So in conclusion, 3 outcomes that can be really valuable if you pursue this in the right way. You can increase education and engagement around your most important issues and your organization's most important issues. And really, in the end, that is what I think is the thread. I talked about it a little bit in my background, the thread and the work that I do, but it's really the thread here too. You do work that is geared to improve people's health or population health. You want to educate people about what you have found, or you want to educate the general public about how they can have better health outcomes. It's no different in terms of what you would do on a digital or social platform. Establish an active network of organizations, thought leaders, and informal ambassadors. If you think about the network that you have in real life, you want to find a way to translate that to the digital space and then try to expand it. And it's really important, again, purposefully adding the last one there, informal ambassadors. If you can find people out there who aren't part of your staff, but who believe what you believe, they sometimes become the greatest distributors of your message, the greatest connectors of you to other people than you would be yourself. So don't discount those folks and just focus on the top of the chain. And then lastly, build a foundation for future efforts. What you do on digital and social media at the beginning is really, really hard. Think about how hard you work that first time that you're biking, that you're trying to get a bike up a hill. You have to really push the pedal really hard at the beginning, but once you get moving, it gets a lot easier. Once you've established that foundation, that's where the cool ideas come from. A lot of the things, for instance, that we've suggested to the foundation over the last several years are because the audience was built up, because the foundation was there. So lastly, many presentations and meetings end with a call for what are our next steps, right? Everyone likes to talk about that. It's a very important best practice. But I would like to reframe it a bit and say that the most critical thing at this stage is for you to make a commitment. That is your next step. Commit to identifying how digital media can become a central component of your work, both for you individually and within your organization. Here's one way to think about this as you participate in person in this wonderful roundtable today. You are here to actively define yourself and your perspectives, your research or your organization's core beliefs. If you didn't participate, if you weren't here, then others might forget about your impact or they would simply define you in your absence. So why would you treat the digital space any differently? Now is the time to harness the digital definition of yourself and your work, and to use it to help propel that work forward. Thank you very much.
Thank you very much, Carlos and Dana. I know that I have a ton of questions that I've written down throughout both your presentations today. So now we're going to break for lunch. And I'm looking at Sandy and Alina to make sure that I've got this right. We're going to come back at 1:30, thank you. We're going to come back at 1:30 sharp, and I do mean sharp. So if you don't get in the queue early and often, we're going to continue the conversation. So please join me for lunch. For those who are joining us via technology, take a break, and we'll see you back here at 1:30. Thank you so much.